Welcome to Dental All Stars. I'm Eric Vickery, lead mastery coach at All Star Dental Academy and president of Vickery Coaching. And I'm so excited to interview our guest today, Dr. Troy Walton. Dr. Walton practices in northern Utah. He met his wife, Nicole, at Utah State University, where he began his collegiate education. He continued his education at the Creighton University School of Dentistry in Omaha, Nebraska, and graduated in 2005. After graduating and working for a year as an associate, he started his practice from scratch in 2006. That's a quick turnaround. That's really good. He discovered All Star Dental Academy in 2017 and loves using All Star Dental Academy in his practice and his daily life. Dr. Walton believes in lifelong learning and strives to stay abreast in the latest dental advances. He maintains membership in the American Dental Association and Academy of General Dentistry. Through his continued learning, he has taken special interest in TMD and airway dentistry and has successfully treated hundreds of patients. So welcome, Dr. Walton. As you know, we've been talking and I've been very interested in airway dentistry, and I really wanted to get your insights to help, dentists out with not only understanding this, but how to implement this in your practice. So why don't we just jump right in and tell us, what is airway driven dentistry? What does that mean?
Airway driven dentistry is focused on treating and developing underdeveloped airways in children and adults, which makes other dental treatment often more straightforward and easy. In order to really gain a really good understanding of airway driven dentistry, we need to understand the cause. And a lot of times, the main cause is epigenetics, and epigenetics is how the environment influences our genes. So in an ideal situation, we have a genetic blueprint, and under ideal conditions, we grow to be our best self. Mm-hmm. And under non-ideal situations, we don't. Mm. And so, for example, if we look at like our ancestors 400 years ago, they had straight teeth, they had all their teeth, and they didn't have cavities. And it's like, why? And some of the answers go into how they ate, how they developed. And so starting with babies, they only could feed their babies one way. They had to breastfeed their babies. Yeah. And that introduced specific forces on facial development. And also the food they ate. They had to chew their food a lot to eat. They didn't have any processed foods. So those two main forces stimulated proper facial development, like an outward, downward, and forward facial development away from the airway. So today, with the dawn of industrialization, we had a lot of advances, but some of those advances hindered our growth and development. So number one, mothers started going away from breastfeeding, and the uses of pacifiers and bottles became common practice. And I know there's a trend going back towards breastfeeding, and every mother has their decision, and they have that right to choose. With industrialization, we have processed foods. It's way easier to eat food and chew and swallow. So we have a lack of muscle development in our tongue and chewing muscles, which hinders our growth and development. Yeah. So that's a big cause. So I have a really great example. Of my daughter. My daughter is a great example. So she was breastfed for about a year, and she ate what we ate. However, we used a food processor to grind up the food to make it nice and soft and stuff like that. So another thing is she loved her pacifier. She just had to have that pacifier all the time. And to the point, like when she was 3 years old, we were like, we need to get rid of that pacifier. And we tried all sorts of things, cutting it, putting stuff on it. Nothing worked.
A little bit of salsa here or there.
Yeah, a little bit of salsa. And the thing that really we finally decided to get the Binky Fairy involved, and we put our pacifier in the mailbox, and the Binky Fairy delivers some Twinkies.
Oh my gosh, that's awesome.
And we had success. Finally, we got rid of the pacifier. However, along the way, like when she was 2 years old, she's always been our smallest child. She's small. She has a small face. Everything is just small about her, and she had like swollen wrists, and when she was 2 years old, we discovered that she had arthritis, juvenile idiopathic arthritis. And we would take her to the doctor, and we tried all sorts of medications, and nothing seemed to work permanently. Like we switched from medication to medication to medication. And then also she was a grinder. She would like grind her teeth. And when I was in dental school, we were told, oh, they just grow out of grinding. And when I started learning more and more about airway driven dentistry, I'm like, I need to treat my daughter. And so I did. I got there, learned what I need to, and then got started treating her. So right before I started treating her, I tested her sleep. She never complained about her sleep or anything, but I tested her sleep, and I used a high resolution pulse oximeter and discovered that she was like getting like having 15 interruptions an hour in her sleep, which is really significant for a child.
Wow.
And so I also did a CT scan so we could compare before and afters. So after about 2 years of treatment of developing her face, she like the medications, like like their rheumatoid, not rheumatoid doctors, but the name skips me.
For her arthritis that she was taking.
The autoimmune doctors were like, the medicine started working. Like they switched her to one and it started working. So anyway, I tested her sleep at the end, and her interruptions were down to 1 an hour. Wow. So there's a significant improvement, and her skeletal profile was so much better. Her face was so much more full, and in fact, I developed her to a point where she had really big spaces between her teeth. So now she's in braces to try and close those spaces.
Sure.
But try to maintain the growth that we had. And I forgot to mention that I started treating her when she was about 11. So from 11 to 13,
Gotcha.
11 to 13, we started treating.
Would you say that's late or does it matter? Like that's just the normal age, or just whenever you catch it?
Obviously, if you can catch it earlier, the better, because you gain that growth potential and you can use it to your advantage. However, there is no age limit to use this technology and these techniques.
So and so now when you mentioned her arthritis, are you saying that this treatment also helped her arthritis, or?
So there's no scientific evidence associating with like sleep disorder breathing with arthritis, but I'd like to think that I played a part in that.
Okay, that's awesome.
So there's no scientific evidence, but there's lots of other things that are associated with bad sleep or bad breathing,
or just oxygen intake.
Yeah. I mean. Yeah.
So if I'm understanding correctly, did you use like a palatal expander or something? Is that what you use?
And it looks like it's a palate expander, like slow palate expansion. Like the idea of rapid palate expansion is not airway driven dentistry. But it does help.
Yeah. So slow. So you're using the body's growth for a child, adolescence, right? To use that to your advantage with the expansion, and then ortho afterwards. Now, do you do ortho yourself, or is she going to the orthodontist at that point?
She's going to the orthodontist.
I gotcha. Okay. So when we say what is airway driven dentistry, you're talking about skeletal changes, not a appliance that you put in someone's mouth to adjust their jaw so they breathe differently, or is it both? Or
That's a good question. So like if somebody has sleep apnea, you can
Yeah.
use a mandibular advancement device,
Okay.
but we're going to use a twist. We're going to incorporate some of those same characteristics to grow like a palate expander with mandibular advancement. So we develop the facial skeleton to create a better airway, and at the same time we're managing the airway with the mandibular advancement device.
So it could be both then.
Yeah,
Gotcha. Gotcha. And that could be adult or children.
yeah.
Okay.
Well, with a child, you don't really want to use. You're just going to let them grow.
You're going to use the growth and the expansion. Okay. But adults, you
Yeah,
could use an appliance to help with sleep apnea and things like that, correct?
correct.
I gotcha. Okay. So really the poor, airway, someone laying their mouth breathing or whatever it is, it has all kinds of other health implications is what you're also saying, right?
Right.
What are you seeing as like people coming in with this ailment and then you're associating that with airway? I mean, is there other things besides this? Like now that you've been doing
Yeah.
it for a while? Yeah.
Yeah. That goes on to like our next question. So airway problems. A lot
Yeah.
of like we see people with compromised airways. So somebody that has a compromised airway has a decreased ability to breathe through their nose sometimes, or we often will do like a CT scan when they're awake, and we have no idea what's happening when they're asleep, if their tongue's falling back in the airway or whatever. So airway, so a lot of the problems, I mean, a short list could be like sinus problems, allergies, emotional well-being, like anxiety or depression, ADD, ADHD, TMJ problems, upper
Yeah.
airway resistance syndrome, obstructive sleep apnea. And then obstructive sleep apnea is directly associated with some of the big health problems that we face in the United States, like diabetes, heart disease, stroke, heart attack. So
Almost like periodontal disease too. There's just so much systemic connection in all of this, and I'm sure there's, obviously TMJ plays a huge role in this, I would think, and
yeah,
and then you mentioned one that struck a chord with me, which was like the allergy thing. To me, that like if someone has seasonal allergies, that should be like a huge red flag to what's going on and the potential for an airway issue, right?
yeah.
So do you screen your patients then when they come in? You ask them things like this, do you have seasonal allergies? Like seems like it's off the beaten path, but do you now go through a series of questions for them?
It's just in my health history.
Yeah. Yeah.
Now when I look at my health history, it means more to me.
Yeah.
I can associate a lot of things from their health history and I can look in their mouth and say, oh, you're underdeveloped. And then I can make a connection with the patient and we can have a conversation.
Yeah. Yeah.
And perhaps pursue. Yeah.
Has there been some sort of like crazy turnaround in someone's health where they came in with something on their health history? Obviously your daughter, but you treated them with the airway and now that other ailment that seems to be not even associated is now gone. Like they don't have allergies anymore or whatever. Do you have an example of that?
Yeah, I have an example. So I had a patient come in and I didn't look at her medical history. I just looked in her mouth and I saw, hey, you're a little bit underdeveloped. And I just started asking some questions about sleep.
Yeah.
And she reported that she had nightmares. And she's an adult. She's a little in her 30s.
Mm-hmm.
I don't know, maybe late 20s. And so she was like, yeah. And then I suggested we screen her sleep with a pulse oximeter. I didn't have a home sleep test unit at the time.
Gotcha.
And we screened it, and there were some interruptions in her sleep, or what they call arousals in their sleep. And I said, hey, you might have some issues. And she took it a step further and went to her primary care physician. And she had a polysomnograph done, and she got a diagnosis of sleep apnea. And I forgot to mention, she was pregnant with twins when we were having this conversation.
Oh, wow.
So right after she had her twins, she had the polysomnograph done, and she decided to start treatment with this airway-driven approach. So we got her in a biomimetic oral appliance therapy and a mandibular advancement component as well. So within a short period of time, her 9 years were gone. And we treated her for about 18 months and created really great facial development. And we tested her sleep again, and her arousals were, I got to add this. When we tested her sleep again, 18 months of treatment, her twins were, did I say twins before?
Yeah.
Yeah, she had twins. They were both teething when she did this sleep test before again. So it wasn't ideal sleeping conditions.
Gotcha.
And her sleep was great.
Yeah.
She had no signs of sleep apnea.
Wow.
So
even with twins screaming in the middle of the night, she still got a good night's sleep, huh?
Well, as good as you can get with screaming.
Yeah, I hear you on that one. That's awesome. Well, look, obviously, when you see results like this, it helps you be passionate about what you're doing. So has it given you are you like, energized with dentistry? Like, is it giving you more passion? How is it for you personally?
It kind of adds a whole new dimension to what I do. Like the ability to help somebody with their smile. There's some satisfaction to that, or just maintain health in somebody's mouth, but the ability to actually improve their health just beyond their mouth is incredible, and it's really great.
Yeah, no, I can hear it in your voice when you talk about it and the results you get. Are patients raving about it? Like, do they talk about it? Are they doing reviews?
Yeah, they do rave about it. Specifically that one that I just finished treating. She's like, I tell everybody about this, and she loves it.
That's great.
Her life. In fact, it's funny. She was just going through and getting a life insurance policy, and she had the diagnosis of sleep apnea. And so that, of course, increased her premiums, and her doctor took off her diagnosis, and so it influenced her premium as well.
So she no longer has sleep apnea, and therefore it's helping the bottom line. Well, good for her. That's awesome. So, and obviously we've been talking about this, a correlation, with how you take airway driven dentistry and you put it in a general practice, but how does it relate to, how do other specialists see it? How does it relate in the big picture of treatment planning? Let's say I'm a dentist, and I'm wondering, how do I make this work in my practice, and how does it relate to everything else I treatment plan with other specialties and everything?
Well, let's talk about how it influences all the specialties and general dentistry real quick.
Okay.
So like with general, a lot of the like a compromised airway, when we go to sleep, a common response that our bodies have if there's a restriction or obstruction when we're breathing and trying to sleep is clenching, grinding. And the act of bruxism influences almost every single specialty. Starting with general dentistry, the restorations we place in teeth and the longevity of restorations and the longevity of teeth are influenced if they are clenchers and grinders, and also the complications with TMJ problems. And periodontics. If somebody has periodontal disease to begin with, and they have some obstructions, it can turn into secondary occlusal trauma, which could compromise the teeth, and they could lose them. And also recession. Clenching and grinding and bruxing influences recession and can progress that as well. Endodontics, if you are a bruxer, and all dentists know that if you put a filling in, if it's a little bit high on a bruxer or a clencher, they're going to be back in your office, and it could result into like irreversible pulpitis and endodontic treatment. So ortho, the idea of an underdeveloped face. Almost everybody needs braces, and with that need, we also see a more prominence of class 2 malocclusions. So if we can guide growth and development, we can avoid some of these things that cause compromised airways. Oral surgery. I mean, the potential is there. If we catch a kid young enough, we can develop their face so they have room for their third molars. And they don't need to have extractions like everybody.
Oh, wow. I didn't even think of that.
So in fact, I have a story of somebody I was treating. I have one of my hygienists works in another office, and she was treating this patient, doing an exam and cleaning. Well, not the exam, but the cleaning. And she noticed that her arches were just like awesome. They're just so full and developed. And she's like, wow, that's awesome. And she's familiar with Airway Driven Dentistry. And she's like, we get these results a lot with some things that we do in our office too. And then she mentioned it to her dad. And he's like, yeah, do you know Troy Walton? And it's kind of funny. He's like, he's treating her.
Wow.
So it was kind of crazy.
That's good. That's good. Well, that's what I'm thinking about here. I mean, obviously, if an oral surgeon's listening to this, we're maybe affecting their business with wisdom teeth extractions, but I get the health side of it. And then I'm thinking orthodontists, how do they envision you doing palate expansion? And so how do you get these specialists on board with the treatment plan and the vision of this?
So, if let's say I take a teenager, I'm like, we can develop your airway, and sometimes we can avoid the need of braces, sometimes, but sometimes we still need that. So you get them developed, and you just kind of let their muscles and the appliance just kind of take the teeth where they're going to be, and sometimes that's good enough for the patient, which, yeah, it might hurt the orthodontist a little bit, but sometimes they're like, I want them perfectly straight. And so then you send them over, or you could even do at that point, clear aligners, a lot of times are enough to just straighten up the teeth.
Well, and that's what I was going to ask you. Do you do Invisalign in your practice or something like that?
Yeah.
Yeah. Okay. And if it's simple enough, you can do that. I gotcha.
Yeah.
Okay.
Yeah. It creates a complex situation and unravels the teeth and makes it simple, so you can use something simple like a clear aligner.
I would think at some point you would almost want referrals from the orthodontist, and you'd want to work closely with them. Do you see that happening, or is there still some friction in that relationship?
Oh, there's friction. I mean, but I try to reach out to orthodontists, and sometimes they'll send over a referral to extract teeth. I'm like, hey, you know what? Maybe we could do this, and it's made some friction, of course.
Sure.
But at least it brings some awareness, and not all orthodontists are trained in airways.
Oh, no, absolutely. Yeah. I would think there would be some diversity there in just how they even believe the treatment plan. So yeah, I get that.
So yeah, you can create some enemies in the process, but I mean, the end goal is helping the patient, right?
Well, yeah, I mean, in the end, it's what you believe is going to be best for care for the patient. Absolutely. So speaking of that, I always think in terms of, all right, someone's listening to this, how can they benefit from listening to this interview? And how easily can they implement this in their practice, right? Or how complicated is it to implement this sort of system in your practice? So maybe give us a quick, I guess, promotion for why someone would want to have airway dentistry in their practice, or maybe referring to someone who does in their town, whatever. But how easy or complicated is it for me to all of a sudden say, all right, I'm passionate about this, I want to put it in my practice?
I mean, there's a lot of learning that's involved to be able to apply this in your practice. And it's almost like, I guess you could compare it to like getting a master's or something like that, dentistry, or even like a specialty almost. I mean, you put a lot of time learning more about airway driven dentistry. So there is some that requirement, but the implementation, it is challenging to get the whole team on board and get them up to speed. There are some hurdles there. like financially,
Yeah.
it's about the same. Like I try to keep it about the same as the price of braces in the area that you're working in.
Hmm.
So it's on par with like orthodontic treatment, like a full case of orthodontic treatment.
So you're not having to maybe bill medical, or are you billing medical for some of it?
I try to build medical as much as possible so I don't use up their orthodontic coverage if they
Yeah.
need to use it.
Gotcha. Gotcha. So you must have had to learn how to implement medical billing in your practice then.
Yes, and there are some hurdles with that. And I I initially started having my receptionist or my insurance people do the medical side of it, and it was just so time consuming. It took away from their job
Hmm.
of doing dental. And so I actually just hired a medical billing company, and they
Hmm.
do a lot of the verification of benefits and the pre-authorizations. And we of course give them the information, but then they do all that back work.
So you're outsourcing the medical then. What company are you using?
I use Imagine Billing, or I think they changed their name to Dev Dent. There are several out there though.
So you
There's a lot.
said I want to make sure you said Imagine Billing, but they changed their name to what?
Dev Dent,
Dev
DVDNT.
Dent. Okay, cool.
Yeah.
All right. And then equipment. Is there a lot of equipment to buy?
It's really important to see the airway. So CT scan has a large field of view, so you can see
Yeah.
straight down if you can get down to the third vertebrae. Like the CT scan I have is 17 by 20, if that means 17 centimeters by 20 centimeters. So I can see a lot.
Yeah. Okay. I'm just curious, do you do implant surgeries?
I've never gotten into implants. I've just been
Okay.
passionate about learning about airways. And
Yeah.
it's just taking
Because
me down this course.
you hear the same sort of thing in the CT scan, equipment side of things. So maybe if someone already has, CT scan in their office for that views enough for doing implants, they could also add this pretty easily because they already have that equipment. Does that make sense?
Yeah.
Okay.
Yeah. Usually when it's like they buy a CT scan, they often don't have a large enough field of view. So
Yeah.
it's almost they have to upgrade to get the airway field of view.
Gotcha. So if you're out there listening, you're thinking about buying a CT scan, it'd be a good idea to make sure you get one that has a big enough view, right? I
Yeah.
try to tell doctors that all the time. Don't limit yourself. You never know what you're going to be doing down the line. All right, good.
Yeah.
What you mentioned earlier, like a home test or something they take home
Yeah.
with them or something. Tell me about
Home
that.
sleep test unit. Yeah, that's another great tool to have. Every state is different, but if your state allows, you can do home sleep test units, and my state gratefully allows me to do it. So it is one less hurdle I have to go through to get them tested. But
Yes.
I don't read the sleep test. I send it to a sleep physician. They read it and give the diagnosis so that we can move forward
Gotcha.
with treatment.
Okay.
And of course, I have to pick my cases carefully. If they have severe sleep apnea, they need a CPAP. There's just
No way
they
around it.
go. Yeah.
I gotcha. Now, so I want to insert here, if you're listening, probably the first thing you got to do is check with your state and see what are your limitations before you jump into this, because my guess is it's a lot easier for you to hand someone a sleep test unit than it is to then refer them to a sleep study center, right?
It's another hurdle, and so it's easier for the patient. Patients like easy, right? And so
Compliance. Yeah.
yeah.
Yeah, for sure.
Yeah.
For sure. How has this affected your schedule? Like, obviously doctors who are listening to this, they do things like scheduling a goal. They see so many patients a day. They want to hit that goal. They want to get people healthy, but they also need to run their small business. Or
Yeah.
large business. So how has it affected your schedule? I mean, like I hear doctors are starting ortho and they're just seeing so many more patients and it just changes things. So is this, hand picked? Is this, a productive thing? Tell me about it that way.
It's been an interesting journey to find the right way to do this, because you see people and you'll be like, you're underdeveloped, we need to talk.
Mm.
And sometimes I think I was a little bit overbearing and excited to share, and it wasn't great for my patients. But anyway, so you find that balance. Now I compare their medical history with the conditions I see in their mouth, and we make some connections, and then we have a conversation. If they're interested, I schedule a different time to talk about it more in detail, and I call it a records appointment, where we screen. We do like a CT scan and just see if I can help them, see if they're a candidate, and if they're interested in treatment. So,
And then once that happens, then you have them back. I'm assuming for like an impression, or you do a consultation, or do you do like, and so, how does that, is that the flow of it?
yeah, that's flow. Like if they want to move forward with treatment, then there's an impression, and I usually will say half down before we send it to the lab, or something like that. So I have a commitment, financial commitment on their end.
Yes, yeah, absolutely. So you said the word financial commitment. All right. So,
Yeah.
as a business owner, I'm a dentist. Let's say I'm a dentist. I'm a business owner. I'm thinking about investing in this. Maybe I don't have a CT scan, but I'm passionate about helping people, and I really have a connection to airway dentistry, and I think that would be a good way for me to go. Would you say this has been a positive financial situation for your business? Has it been a plus for you?
Yeah, I was just before this call, I was looking through the number of cases I started like a year ago this month, and I started about 5 cases, and about a year ago, and this last month I started about 5, so it's just been like 5 a month for me.
Okay.
I mean, just talking to
Perfect.
patients, and so it's not like overwhelming, but
Yeah.
I mean, your own patient base there's so many patients in your own patient base that you can see and help and treat.
So while you're searching through your acres of diamonds in your own practice, my mind is saying, okay, now I can take time in marketing this, whether it's SEO or on my website, or it's through other general dentists who don't do this, that can also learn about it and refer to you. Like, that's a part that you can grow. I mean, for our TMD, TMJ dentists out there, it's like having a practice within a practice. And, so for those that are listening, think in terms of, I'll have access to people right away that I can treat while I grow and educate those out here to bring external referrals that'll just come in for airway, but then they'll go back to their dentist and things like that. Is that something you've thought about doing, or are you just focused on, hey, these are my patients, I'm just going to take care of my patients and just keep it small?
I haven't really reached out to dentists that much, but other healthcare providers I have.
There you go. Okay, I understand. Yeah.
So like, if you start, for example, treating somebody that's your own patient, and they have a primary care physician, and you start treating them, and you inform the primary care physician, and I'm treating your patient, and this is why. And then after you get done treating, you send them another letter and say, hey, this is what we did.
Nice.
And then they're like, hey,
results.
So then, I mean, your network is not just dentists, but in fact, a better resource would be those that are in the trenches dealing with sleep apnea every day.
Yeah. Beautiful. I love it. Yeah. So what's something you would say to a dentist who's listening right now, no matter what age they are, oh, I'm too old to start doing something new, or whatever, or I'm too young, I'm still trying to figure this out. Like, what would you say to someone listening to say, if you think you're passionate about helping people in this way, here's where you can go start, or here's how long it takes, or encourage them to get into this?
There are a lot of, well, not a lot, but there's a few companies out there that market Airway Driven Dentistry. And
okay.
I'm not familiar with all of them, but the one I learned from and got trained from is Vivos Therapeutics. And
say it again for me.
Vivos Therapeutics. And you can go to their website at vivoslife.com, and they have some clicks or places to click if you want to find out more information.
And would you say start to finish, how long of a process was it for you to, okay, I started learning about it and then I had my first case? What would you say?
Vivos Therapeutics has done a great job preparing dentists, and they have this team of people that will help you along the whole way. So that from clinical to practice management.
Wow, that's good.
And so they have a series of courses, and they call them blocks. They have 4 main blocks where you learn the material, and it's like you could call it a residency, like like a mini residency, 4 2-day blocks of information. And at the end of that, if you're confident enough, you can jump right in, and you'll have people holding your hand along the way.
That's great.
For example, in Vivos, I've done enough cases that they want me to actually help other people, other dentists get started. So I kind of mentor other people as other dentists as they're getting started. And
that's great.
So
there's
a lot of help.
Yeah. And I'm thinking, oh, I can hear you. If you can hear me, we're still going. So we're back live. The thing that I would say too, you mentioned something earlier, is you were so excited that your patient was a little taken aback or maybe felt overwhelmed or whatever it is. So obviously your verbal skills on case acceptance in this are going to be a key factor in, if I go through all this, I invest the money, I invest the time and energy, but I don't have the right verbal skills to help the patient understand why this is important, what the concerns are, what it's doing for them, how it's affecting their health, they're not going to move forward. And so be sure that, again, for those that are listening to this, that you're getting training from someone on how to present to your patients. It's not about presenting palate expanders. It's about presenting the concerns with their health. Here's what I'm seeing in your mouth. I'm guessing that affects you somehow here, here, and here. How concerned are you with making sure that you live a long, healthy life without these ailments affecting you in other ways? Would you like to know a way how we can help you stop that? Like, those are the types of skills that you got to work on and be able to explain to patients. And I'm assuming, Dr. Walton, you've gotten better and better at this over time.
Yeah. I mean, I used to talk to, how I told you about the whole history of epigenetics. I would take 20 minutes to talk to a patient. They don't care. They just want to know.
You say, I don't even know that word, epigenetics, and everybody goes, oh, okay. You lost me in epigenetics. Yeah. You got to know how to talk to them, right? Yeah, absolutely. Yeah. Absolutely. So you got to connect with them. And so what I would say is, if you guys that are listening want help with case acceptance in this regard, maybe you're doing this, but you're not getting the results you want. Obviously, All-Star can help you with that. If you're interested, you can send an email to heather@allstardentalacademy.com. We're here to help you with case acceptance. But get a mentor. Like Dr. Walton said, he's practicing, he's helping those that are just starting to practice this. You got to have someone to bounce these ideas off of. I mean, I'm assuming you agree with that, right?
Yeah, totally.
Absolutely.
All-Star is awesome for that kind of stuff.
And I think being a mentor is helping you learn how to do it better too. Yeah. When you're ready to learn, the teacher appears. There's that one, right?
Yep.
All right. So there's people out there, obviously, Vivos, that's great. All-Star's here to help on the other side of things. You have mentors like Dr. Walton who will help you get through this and navigate this. So I think this has been a great talk. Do you feel like we covered everything we should have today for those that are out there listening, considering this?
Yeah, I think it's a good introductory to, if people want to know information, I think it's a good start.
Yeah. No, I really appreciate you sitting down and taking the time with us to share your passion for this. It's been really good. And for those that are listening, thank you for joining us and, really just taking the time to invest in yourself. So obviously, if you like the Dental All-Stars podcast, please, subscribe to it, share this with your friends. You can put it on social media, and we really appreciate it. So until next time, go out there and be an all-star.